Cretinism or congenital hypothyroidism. Congenital hypothyroidism is a condition that affects infant from birth and results from partial or complete loss of thyroid hormone. Partial or complete loss of thyroid hormone. Important clinical features: constipation, sleepiness, umbilical hernia and rough skin. Constipation, sleepiness, umbilical hernia and rough skin. Constipation, sleepiness, umbilical hernia and rough skin. Now management. At first, management. Clinical features, symptoms and signs. Symptoms and signs. Symptoms include constipation, sleepiness. More symptoms include prolonged neonatal jaundice. Prolonged neonatal jaundice in case of 75% patient. Feeding problem, 40% case. Lethargy and constipation. Lethargy and number first, constipation. Signs: rough skin, and number two, umbilical hernia. More features: coarse faces with large open fontanelles, large open fontanelles, large protruding tongue, coarse faces with large open fontanelles in 35% case, large protruding tongue in 45% cases. Hoarse cry, 45% case. Horse cry in 40% cases. Umbilical hernia, 60% case, and rough skin or cool, dry and mottled skin in 45% cases. Hypotonia and delayed development. Epiphyseal dysgenesis. Impaired physical growth and development and mental retardation. Investigations: serum FT4 and TSH. Serum FT4 and TSH. Thyroid scan, thyroid ultrasonogram and skeletal survey. FT4, serum FT4 and TSH. Low FT4 and high hypothyroidism, high TSH, primary hypothyroidism. Both TSH and FT4 low. Problem in pituitary gland. Thyroid scan to detect ectopic gland. Any ectopic gland. Thyroid hypoplasia or aplasia. Thyroid ultrasonography to assess the anatomy of the thyroid, whether enlarged or absent gland. Skeletal survey, absent distal femoral and proximal tibial epiphyses. Distal femoral and proximal epiphyses, which is supposed to present at 36 weeks gestation. Epiphyseal dysgenesis for older people. Treatment: counseling, treatment of cretinism or congenital hypothyroidism, counseling and drugs. Counsel parents about the consequence of untreated cases and importance of regular continuation of treatment with thyroxine. Drugs. Sodium L-thyroxine. Drugs. Sodium L-thyroxine. Thyroxine dose 10 to 15 microgram per kg per day. 10 to 15 microgram per kg per day. And for children, 4 microgram per kg per day. And for children, 4 microgram per kg per day and lifelong. Follow-up can be done by serum level of ST4, serum FT4, TSH and clinical features after starting of drugs. Congenital hypothyroidism is called cretinism. Is a condition that affects infant from birth and result from partial or complete loss of thyroid hormone. Important characteristics: constipation, sleepiness, umbilical hernia and rough skin. Symptoms: constipation, sleepiness and jaundice in 75% cases, fever in jaundice, feeding problem in 40% cases, then lethargy. Signs: coarse feces with large open fontanelles in 35% case, large protruding tongue in 45% case, hoarse cry in 40% case. Umbilical hernia in 60% case, and rough, cold, dry and mottled or rough skin in 45% case. Hypotonia and delayed development. Severe manifestation: short limbs, epiphyseal dysgenesis, impaired physical growth and development, and mental retardation. Investigation: serum FT4 and TSH, low FT4 and high TSH. Primary hypothyroidism, both TSH and FT4 are low, so problem in the pituitary gland. Thyroid scan to detect ectopic thyroid gland, thyroid hypoplasia or aplasia. Thyroid ultrasonogram to assess the anatomy of the thyroid, whether enlarged or absent gland. Skeletal survey: absent distal femoral and proximal tibial epiphyses. Absent distal femoral and proximal tibial epiphysis, which is supposed to present at 36 weeks gestation. Epiphyseal dysgenesis for older people. Treatment: counseling and drugs. Counseling parents about the consequence of untreated cases and importance of regular continuation of treatment with thyroxine. Drugs: sodium L-thyroxine, newborn 10 to 15 microgram per kg per day, and for children 4 microgram and lifelong.